guys, welcome back to Medical Coding with Blue. Today's episode is all about questions you should ask during a medical coding job interview. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, so you are in that job seeking process time and perhaps you're going through the job interviews and they always ask that one magical question: do you have any questions for me? And so to this, you should always respond with a series of questions, not just and never, oh no, I think we covered everything. You need to ask something, okay? So the thing that you need to start building on is what is going to go on in this position. So you want to start off by asking, what is the ramp up period, or what is the probationary period in the beginning, right? You need to know how long they're going to give you to complete all of your training as far as like learning the electronic medical record and things like that, and the other processes that happen there. And you need to know how long they're going to give you to get up to speed on your productivity and your accuracy, okay? Some places it's going to be 30 days. Most places it's going to be 90 days, okay? It really all depends on the employer. So to that end, at least this way you'll be able to know how much time they're going to give you. So the other thing you can ask is, what is the productivity standard? Now, if you have a list, if you want to make a list of questions for them, this would be great because this is going to show that you are being proactive, okay? So ask them what the productivity is like and what is the average that they are expecting you to do every single day. Now, it's going to be an average. It's always going to be an average because people cannot hit the same amount of encounters every single day. There's going to be times where you're going to have meetings and there's going to be other tasks that you have to do that's going to take you away from medical coding. So don't worry if you don't always hit your productivity, but that's the one thing that you can ask: what is the average productivity rate per day that they want you to be at, okay? Then you're going to ask them about accuracy. What is the accuracy standard? And for some places, it's as high as 97%. Some places it's at 95%. I have seen some places as low as 93% accuracy. Then you want to ask them how many records are audited. How is the auditing process done? Is it done monthly? Is it done quarterly? You're going to find this out because this is going to affect, how is your accuracy doing? Of course, you don't want to get to a point where they're going to have to put you under, process improvement or anything like that. But you want to get all the information that you can. What is the accuracy standard and how do they reach that? And when you are getting audited, you can also ask, when I'm getting audited, how is the rebuttal process? Ask them about this. They're going to be very interested to know that you are asking about this because you have to be able to have your time for rebuttal whenever you are getting audited, because sometimes the auditor is not always going to be correct either. We are all human. We all make mistakes. No matter how seasoned the auditor, they will make mistakes. Everybody makes mistakes, okay? Even the best, most well-trained medical coder can still make mistakes when they are doing auditing. So that's the other thing that you have to know. When you are doing the audit process, and they ask you, how would you argue if you felt that you had something right? Then you can tell them, well, that you would look at reputable resources like the coding clinic, like using the Merck manual, using the ICD-10 CM coding guidelines or the ICD-10 PCS coding guidelines, using the manuals, okay? You want to tell them that you're going to use reputable resources, not just whatever.com or some answer board that you found on Facebook that they said that this was okay. You always want to be able to show that you can back up your arguments. And that's the one thing that you can tell them, okay, when you're asking about audits, because that's going to be a very big thing. Ask them what clinic would they assign you to, as far as like, is it going to be just one particular specialty, or are you going to be like a rover going to different specialties and things like that? So if that is the case, then you can further expand on that question and ask them, okay, how long will I get to learn this clinic? How long do you expect me to be up to speed once I've been in the door? Because once you have like their process down and everything, the ramp up time when you're switching different specialties, if they have you do that, shouldn't be quite as long. Sometimes it'll be maybe a month or so, to get up to speed in the new clinic. But just you can just ask them, because you're having a conversation. That's the whole thing about interviews, is that it's a conversation. They are going to be looking at everything, not just your answers to these questions. They're going to be looking at your demeanor. They're going to be looking at your attitude towards things, okay? Your attitude towards accepting challenges. If you are showing that you are resistant to challenges, they're probably not going to call you back. You need to be somebody that is going to be willing to get in there and try, and willing to fall. Okay, I don't get this, and I'm going to try to figure it out. You've got to be able to do that, because that's what medical coders do, and successful ones at that will continue to do that throughout their entire career. Okay, it's not just about your ego, guys. It's about a lot of things. Excuse me. So that you should know, and then you can ask more questions about that. If they're having you go to different specialties, that's great. And that's something that, you can add all of that to your resume as you continue on in your journey. It's always great to have a lot of variety, okay? And it's good to tell them that you are willing to have variety in wherever you're coding. Sometimes they'll ask you, are you wanting to code for just one specialty? They'll ask you because they want to see how willing and open you are to going to different places. And then you can tell them, I'm open to whatever you need help with. And so they tend to kind of like that answer. At least that was my experience when I was applying for jobs. And that's the thing, guys, you have to be, okay, I'm ready to start, and I'm ready to get like my hands dirty and get out there and, really discover what it's all about. So that's something that you can talk about there too. The other thing that you can talk about, and another thing before I go on, you don't want to tell them, okay, how much PTO am I going to get? How much of this am I going to get? What are the bonuses like? Don't talk about all of that other stuff. Talk about the job. Then you could talk about the benefits later, but talk about the job. The job is the most important thing, because they need to see your motivation, okay? They need to see, why are you there? Because if you're just somebody that's there for the money to collect a check and go home, then that's probably not going to be a best fit for them, okay? They're going to be looking at somebody who's going to be invested as much as they are into the job, okay? So I'm just going to say that part there. But yes, so finding out what your work situation is like. Are you going to be in an office? Are you going to be working remotely? And if you are going to be working remotely, do you have to have on-site training in the beginning before you go home? Okay, ask those questions. Are you going to be in your own office if you are having to be on site? Are you going to be sharing a space with others? That's another question that you can ask. And it does affect your ability to be able to work comfortably, obviously. But you have to be willing to be like, okay, I'm going to make this work. And that's just part of it. When I first started off, I was in a room. The very first job that I had, I was in a room, and there was 2 other women, and we were at long tables, and that was our desk. And we had our coding books, and we had stacks of paper records, and that's how we were coding. So we were all together in this one room coding, but there wasn't a whole lot of privacy between all of us, because we were all there. So something to know. And then in my next position, I had my own office. And then there for a time, I shared a space with a few other women. I think there was about 5 of us in that room. And so, it really all depends, on where you are. Is it ideal to have your own space? Of course it is. But sometimes you are going to be put in a position where you have to share a space with other medical coders. And then when I got to my forever home, I was in a room full of bullpens. And bullpens, if you don't know, is like those office cubicles, with no doors or anything like that. But you're just sort of sharing the space communally with other medical coders. There was 20 of us in there. And that was a quite an interesting time. But that's just the way that it is, when you are first working. So, but that's something that you have to ask, get involved in trying to figure out what is going on at this particular place, So you can also ask, what is the provider education like? Because of course you're going to have to submit queries if there's going to be a query that's needed. But sometimes at some places they have you submit the query to the coding educator. Sometimes they'll have you submit the query to the CDI first, and the CDI will decide if this is a legitimate query, and then they'll send it on. That's at some places. Where I currently work, I have to query the provider myself, and I have to make sure that the query is all in order and everything before I send it, and that's the way that works for me. But for those that are out there, this is your first job, that's very important to ask. Does it go through somebody else, or does it, come from you? Do you have to copy other people on this email? Now, I don't like copying a bunch of people on emails anytime I'm doing like education or something. I like to go directly to the provider because to me, when you start like sending out education and you start like putting a bunch of people on there, it looks like you're tattling on that person. So that's why I like to handle it one-on-one with my providers. And of course, the queries go directly to the provider themselves. It doesn't go to everybody because of HIPAA. We go directly to the source, So that's just the way that it is for that. But you want to ask, what is the query situation like? Do you directly communicate with them, or does it have to go through a mediator like a CDI? Okay. Also, you can ask, how are the education presentations for providers? Some facilities will have the coders do this, where the coder is the one who's actively coding for that particular provider, and they will make them do the in-person presentations. It's not as scary as you might like to think it is, because some people will start hyperventilating and tell me, no, Blue, I just can't. Yes, you can. Yes, you can. As somebody who is a shy person telling you that yes, you can. Oh, yes, you can. Because when you start getting into this and when you start getting more confident, you will see a difference in yourself when it comes to being able to do interactions and presentations for providers. Because this is your job, this is your work, this is your career. And you have to keep that in mind when you are doing all of that, okay? So if you have to be the one to do provider education, ask them, how often is this going to be required? Because they're going to see somebody that's, oh, okay, this is great. Somebody that wants to be involved, somebody that wants to be engaged with the providers, and they may like that, okay? So, and if they don't, if it's somebody else who does it, if it's a CDI that does it, then they will let you know right away. But at least this is showing that you're being proactive with education. Doctors are meant to be doctors. They're not meant to be medical coders. They're not meant to select all these things and do all of these things. They are designed to document their encounters with the patients. Is it a bonus if they know how to appropriately select everything every single time? Of course it is. But it's not always the case. And we can't fault them, because that's why we have jobs as medical coders, to select the appropriate codes, to know the rules, to know those levels, and to know, what we need to get certain procedure codes and things like that. That is our job. So our job is to help them, okay? To help them to make sure that they're documenting everything appropriately so that they can get full credit for everything that they do, okay? So that's the thing, that it's something that we all have to do as medical coders, okay? And like I said, for some facilities and some places, somebody does that, and other places, it's on the coder. To me, I will always want to be the person who is educating my providers. I don't want anybody else talking to them unless I have vetted them personally before they get to my providers. Now, story time. When we were doing the ICD-10 CM changeover, ICD-10 PCS and that kind of thing, we had a physician champion coming to our facility to do the education for the providers while we were doing it as well, because everybody's learning, right? Everybody's learning at the same time. We're all going through this process all together, right? But they said it would be great if we have a physician champion also to supplement the training that the coders are providing. Okay, great. However, when you get your providers on track, you want to make sure that what you're saying is in lockstep with what the other person is saying. Because then, if you have two people saying different things, then all of a sudden everybody's confused. And I was a little concerned because I didn't know this guy. I didn't know this physician champion who was not in a provider in our facility. He was a provider in another hospital that's in our network. So that's where I was like I'm a little concerned because this is a urologist coming in and he may have a different view of how we're supposed to code and how we do things. So, I'm concerned for my ortho surgeons, and so I got assigned to go with the ortho surgeons to this presentation so that I can listen in as well. And so of course I'm listening with a critical eye, and my supervisor was like, well, if anything, you can ask questions too, and you can make sure that everything is, to your liking as well. So I'm sitting there listening, and he's actually sharing a lot of really great information, and I'm like, wow. And he's a certified medical coder himself. So I'm like, okay, so he knows what he's talking about. And it was a great presentation. And we had a lot of really good feedback with each other because I was like, I'm the coder. He's like, oh. And so then he had questions for me and I had questions for him. And it was a great learning experience for everybody. Okay. So that's just sometimes some of the things that are provided for providers as far as education goes. So never be afraid to do that. Never be afraid to ask if you have to do that, okay? Because that shows initiative. And that's always a great thing for employers, as an employee that shows initiative. And it is quite rewarding because that's something that also can be added to your resume later on, that you perform provider education. Because believe it or not, there's a lot of medical coders that resist performing provider education because they get so discouraged talking to providers who are perhaps a little resistant, to listen to any guidance. But sometimes it just takes a little bit more effort to learn how to manage your communication so that you can reach people who are a little resistant to education and working with the coders. Okay, so that's something that you can ask. Do you have to do provider education, and how often? Because for some facilities, they'll have the coders doing a once a month presentation. Sometimes it's once a quarter, and sometimes it's twice a year. It really all depends on the needs of the providers, which is why I say that teachers also make great medical coders because they know how to engage an audience, so that's something that if you are coming in from the education side, maybe you were a teacher, this is a great transition field for you as well, because medical coding, it takes all types, takes all kinds of backgrounds in order to make a successful medical coder. It takes a village to teach providers. It takes a village to run everything as medical coders, because we are ultimately responsible for the revenue that comes into a hospital, because it's based on the codes that we're selecting and making sure that everything is accurately coded. And it also has to do with the statistics. I guess a little tongue-tied there, but it has to do a lot with the statistics that are coming out of that facility, and are those statistics correct? And so that's just something that we as medical coders do. It's one of our many hats. Okay, so those are some of the things that you want to ask the interviewer, but never say, I don't have any questions. You make up questions, something, anything. Okay, and then you can ask them about CEUs and do they pay for them and that kind of thing. Do they give you a stipend to get CEUs if you need to? Do they pay for the memberships and those kinds of things? So what about attending conference? Is that paid for, or is it like every other year, or is that on the coder? Again, at my facility, I'm not high up enough in the food chain yet for that benefit, but But for some facilities, they do have that, and so that's, I think, is another awesome benefit, because you can get a lot of CEUs that way. Okay, you can ask them about materials as far as like books. Do they give you a set of books? Not all facilities will give their coders a physical set of books, but some will. At my facility, we are given a set of books every single year, and if needed, you can ask at my facility for a supplemental resource book. So for me, I always ask for the coding companion for like the specialty that I'm in, orthopedics or podiatry. Orthopedics has 2 books in their coding companion series for ortho. They have the upper and the lower, and then of course podiatry has the 1 book. Now, a coding companion is a great resource for medical coders in specialty clinics, because it will break down all of the CPT codes for that particular specialty. Then it will talk about all of the applicable diagnoses that can go with that particular procedure code, all of the modifiers, the RVU count, the layman's terms definition of what is included in this particular procedure. So it is a great resource. So that's one of the things that you can ask. Are books provided? Those are, it's very important to have that. And if they don't, that's okay. It just, it's just another thing to continue the conversation. Okay. So after the interview, now, your behavior after the interview is big, because this is going to be, again, the difference of getting a call back and not getting a call back. You can email your interviewer and all the people that were in your interview session, if you have their contact information, their email, one time, thanking them for their time. And then you can mention something about the meeting to kind of like reinforce their memory of you, something that you connected maybe with the interviewer on, and some of the things that you are going to be bringing if you get selected for this role. It doesn't have to be a big, huge letter or email, but just 3 paragraphs at the most, just a few sentences each, maybe a couple sentences or so, and very direct and to the point, and a thank you, and then that's it. Do not hound them. Do not keep calling and asking what's the status of your application or anything like that, because it doesn't make you look like you really want the job. It just makes you look like you're just doing too much. Okay, so only one time, and that's it. If they want to call you back, they will call you back, guys. They won't lose your number. They won't not be able to look you up. They can look you up. Okay, and if you don't get selected for that position for that particular time, if they open up the job listing again, then apply again. That's going to show that you are persistent. Okay, and if they give you an assessment test, you got to take that assessment test. But you have to show that you are professional at all times. Don't get emotional. Do not talk about, your family and why you're doing this and that kind of thing, because that's not really what they want to be focused on. They want to be focused on what skills are you bringing. Okay, we don't need to know about the drama. We don't need to know why you are leaving your other job. We don't need to hear you complaining about your former boss or anything like that. You are coming into this field because you want more of a challenge. You are coming into this field because you are looking for that intellectual challenge, that stimulation, so that you can, thrive in this field. Something. Okay, guys, again, keep the drama to a minimum, and don't start dragging all those things in, so but just do talk about your schooling, do talk about your education. Okay, those are the things that employers are looking for. Okay, they want somebody who's going to be ready and get down to business, not somebody who's going to be bringing in a lot of drama and that they need their hand held. Okay, so to wrap this up, do not say, I've never worked as a medical coder before. You need to act like you've been doing this forever. Okay, you need to be as confident with those skills as you can, because if you're just sitting there constantly saying, I need to be trained, then you're never going to get a call back. But if you ask these questions like I've been suggesting to you in this video today, and you are professional, and you email them the one time after the interview, and then that's it. Then you wait and you see. But in the meantime, still continue to apply for other jobs because you haven't gotten that job yet. And don't put all your eggs in one basket. I'm just saying. So if this video helped you, I hope that you will like, subscribe, and share, and I will see y'all next time. Bye.